Cassie Leavitt, President, East Region Connections Health Solutions.
What inspired you to get into the mental health field?
Oh, wow. I think even as a kid, I just really enjoyed helping people. And then as I got older, realizing that there wasn't a lot of help out there and there was so much stigma. So I wanted to be part of the change to help move the system forward. And I actually started a lot of my work in Arizona, which is kind of like they started a lot of this crisis work. And so it's been really exciting to be a part of that and then move throughout the country and work in different states and really help people understand what's needed.
How did you get involved with Connections?
So ironically, I've known Connections since I was in Arizona and I was working for Value Options years ago when they opened the crisis center in Phoenix. And so I've known about them. And then an opportunity arose a handful of years ago, and I was really excited to interview and get the job to help build new crisis facilities throughout the country.
So I'll take a step back.
Yeah.
What is Connections?
Well, Connections basically is what I would say the founder and national leader for 24/7 immediate access to behavioral health crisis stabilization.
You're now in charge of the East region. So can you tell me some of the big things happening?
Sure. So I think you're probably aware that we're in Arizona, we're in Montana, we're in Washington, and most recently, starting last year, Virginia and Pennsylvania. So as we see growth and opportunity, we're even going to grow more because we're going to open another facility in Pennsylvania next year. So having someone who has the experience with Connections to come oversee the new facilities, making sure that they are implemented appropriately and are running well.
What are some of the things you've learned from the West Coast facilities that you could bring into the East Coast facilities?
So what I think we try across all of our Connections facilities to really have the same infrastructure and the same model that we're using. And that really is, accessibility 24/7 to anybody experiencing a behavioral health crisis or even substance abuse. And so we really want to make sure that that is known in the communities and that we are providing the least restrictive care and options for individuals so they don't have to go to the ED and police can bring them and they don't have to go to jail. So just having that same model across the country is really important to us.
And I live in Prince William County, Virginia.
Oh, you do?
Yes. So for 2 years, I've been covering the Crisis Receiving Center. And it's been going on way before that. So what is it like seeing it almost open?
So I think that you are aware that we started working with Prince William County and all the stakeholders involved in this facility in 2022. So now we're 3 years in and we're so close to opening. It's very, very exciting. And to see, the building's almost ready, not there yet, but even next week, we're going to be doing some law enforcement tours so that those organizations are aware of what we do and can understand our model and see our flow and walk through the building with us. I think it's going to be really exciting to explain to them what we do, because I think that that's something that we need to make sure people understand. We're 24/7. We are available to anybody over the age of 12 to walk in and come receive care.
Yeah. How does it help police in their duties?
So for law enforcement, it can be really helpful tool because they can come and bring individuals who are in crisis, not feeling well, right? Probably having one of the worst days of their lives, and bring them to a center that can actually help the person, again, in the least restrictive environment, and to get immediate access to that care. And we try to meet the police officer and within 10 minutes be able to allow them to get back to their job versus having to wait around in EDs or what have you. So, they're a huge partner for us across the country, everywhere we are, and really partnering with them has been very valuable to our model and how we do crisis care.
Recently, you've been doing some hiring events to get some people to help. So,
We
how important
have.
when you're looking at hiring is empathy?
Oh, I think it's very, very important. Uh, People need to understand, like I said before, folks are experiencing a crisis and everyone experiences those differently. And so people need to understand that and and be, just there to help and to listen and to understand what's needed. Again, everyone has an individual journey and we need to make sure we don't treat people the same no matter who they are. So that's really important to our model as well. And we've helped hundreds and thousands of people over, the last almost 30 years throughout the country. I think the number, Michael, is like 35,000 people a year who come through our door. I mean, it's really important. And what I also think is important is we try really within like a 23-hour, under 24-hour period of time to really help someone feel better and, to go home and not have to stay longer than you need to. Sometimes you're, inpatient. People can be in there for a couple weeks. We are looking for, again, 23 hours or so. And if they need a little longer, maybe 3 to 5 days. But the goal is least restrictive, get folks back into their community and connected with the right outpatient services so they can move forward.
For me, I live with bipolar disorder too, and I always feel sometimes like people just don't understand what I'm going through and all that. So, with your facility, you are really helping people not feel like they're alone or anything.
Yeah, I think that's really important that individuals feel that they can come and it's a safe place to feel better. And, again, it's a short period of time and just, they can walk in. You don't have to make an appointment. It's just come on in. We'll see you. And it doesn't matter if you have insurance or what type of insurance. It doesn't matter who you are. Just come in. And we're willing to see you. And sometimes that means just helping someone get connected in the community. Maybe they don't need crisis care. So we help try to connect folks within their communities. So I think the Community Services Board will be on site with us too, and we'll be partnering with those folks to make sure people are being discharged and referred to long-term care that can help them.
With Prince William County, I know they're
Yeah.
creating something that's different from other crisis receiving centers. What was it like working with them and building something a little different?
I think it's been very exciting. This is the first of its kind in this area. As you know, you live in this county. Um, I think people had a vision for what this would look like and really being able to create a center that helps build a stronger community, honestly,
Yeah.
that has the services that can really help support those folks. So as I said earlier, it's 12 and up we can see. So we have two different areas in the building, youth and adult, and provide a wide array of both outpatient and stabilization services.
So how is the Pennsylvania one currently open going?
It's going really well. So it opened in December of last year, and we have both youth and adult there as well. The youth is 14 and older there. And we don't have, what's different with Prince William County is we have almost the full array of our model. So you have the walk-in, then you have the 23-hour observation. Then you also have extended observation. We don't have the extended observation in Pennsylvania. So we're really excited to provide all of these services to Prince William County and the surrounding areas.
You've been in the mental health field for a long time now,
Yeah.
and then working with Connections. How does it feel to be about a part of something that is really helping people?
Oh, there really aren't words for it. And it's so exciting when you hear stories about how people have been helped who respond. They send in notes that say, you helped me at the hardest point in my life and I couldn't have done it without you. Just just hearing those stories just makes it worthwhile.
What do you do to help your own mental health?
Oh gosh. I don't know. I guess I spend a lot of time with family and friends. A lot of my friends are all in mental health too, so we've, been working together, and it's pretty neat to talk about what people are doing so that you can, use some ideas that others maybe are using. But for me, mental health wise, I love to walk, I like to read, listen to music, just the standard stuff.
Advice would you give anyone that is thinking of going to the crisis receiving center?
I would say, please come. If you are not feeling well and you're not sure what to do, just walk through the door. That's what we're here for. And don't worry about it. Don't worry about, oh, I don't know if this is a crisis. Is this what I should go do? Just come see us and we're happy to help. Again, in a 24/7, we're there.
And the East region is growing. So,
Yeah.
uh, where do you want to see your mission in the next 3 to 5 years?
So I think it's to continue to, work closely with healthcare leaders, law enforcement, and others to find locations where the need is and help build these programs. The model works. We've seen it work in Arizona specifically because it's been embedded there for so long that it's just an opportunity to provide care for folks in a safe, unrestricted environment that they can get better and get the care they need. That's quick too. So it's exciting to see moving into different counties or cities who've never had this, and to see that it's really helping.
So, how can people reach out and learn more?
Well, we have our Connections Health Solutions website that at any time people can go to and find the closest one to them. Again, we're only in certain states, like I mentioned earlier, but um, we're always willing. They're able to reach out via email if they want and ask questions. I'd encourage people in Prince William County to come on down. We're hoping to open sometime next month in October, and I can keep you posted on that if you'd like so that you know what's going on there. We are having an open house community event on October 9th in the afternoon. So feel free to come on down with anybody you want to bring with you to see the facility. Connections just wants to help be a solution in the communities that really need this and are lacking the crisis services. So we're excited to continue to grow and to work with folks like you to get the word out. And obviously, if anybody has any questions, to please reach out to us.